Hello, and welcome to today's webinar on planning and organizing Healthcare for the Homeless Day. This webinar is produced by the National Healthcare for the Homeless Council with support from the Health Resources and Services Administration, Bureau of Primary Health, Office of National Assistance and Special Populations. Content of this webinar does not necessarily reflect the official position of HRSA. This is an hour-long webinar with 15 minutes reserved at the end for question and answer. Please feel free to type your questions or comments in the chat box at the bottom of your screen. If you're having technical issues, please call the National Healthcare for the Homeless Council office at 615-226-2292 and ask to speak to Victoria Rashke. A recording of this webinar will be available on the National HCH Council website within 72 hours. I'm excited to share this presentation today with these fantastic expert panelists. We have Amanda Pears-Kelly. She's the National Director of National Advocacy and Civic Engagement for the National Association of Community Health Centers. In this role, Amanda leads the development, coordination, and management of NAC's federal, state, and local advocacy campaigns and provides technical assistance and consultation to state primary care associations and health centers on policy issues and strategy. David Peary is the chairperson of the Camillus Health Consumer Advisory Board and sits on the board of directors at Camilas House. As a former staff attorney for the U.S. Department of Health and Human Services, David has a broad background in health regulatory and policy issues, including Medicare and Medicaid payment and compliance matters. He currently works as a nonprofit development consultant and grant writer. As Assistant Executive Director for Camillus Health, Tom Campbell is responsible for developing new programs and initiatives, overseeing grants management, and coordinating community relations and fundraising efforts for the health center. He also is responsible for assisting the CEO on special administrative and operational projects. And my name is Brian Zralek. I'm the consumer advocate at the National Healthcare for the Homeless Council. In this capacity, I work closely with the National Consumer Advisory Board, a group of leaders with lived experience of homelessness and HCH services that informs the work of the National Healthcare for the Homeless Council. Today we're going to explore Healthcare for the Homeless Day. We'll first get some context from Amanda Pears-Kelly, who will discuss National Health Center Week. She'll be providing ideas and resources you can use for conducting a successful event. Next, I'll provide context for HCH Day, looking specifically at what makes the Healthcare for the Homeless model unique. Then Tom Campbell and David Peary will describe Camilas Health Concern and the health fair event they put on to celebrate Healthcare for the Homeless Day. You'll also learn about their organization and the goals in carrying out their HCH Day event, as well as how the Consumer Advisory Board helps in making the event successful. At the end, Amanda and I will trade off, providing ideas for outreach and advocacy. Finally, we'll move on to questions and answers and then wrap it up. Amanda, I'll hand it over to you now.
Great. Thank you very much. And thanks, everybody, for making the time to be on the call today. I am really excited. Health Center Week is one of my most favorite parts of my work at NAC and with health centers because it's truly an opportunity to celebrate all the incredible work that you guys are doing around the country and the communities that you serve. So I wanted to just get started with to go over sort of the background and the context behind National Health Center Week and to talk a little bit about the theme. So I hear from folks frequently, why are we doing this in August? It's hot, it's vacation time, it's almost back to school. It just seems like a really inopportune time to be hosting Health Center Week. Well, the magic theory behind why we chose this time frame to host National Health Center Week is that it happens to fall during a month of which Congress is on recess. And part of the purpose behind National Health Center Week is that we really want health centers and advocates to have an opportunity to be in contact with their members of Congress and really with all policymakers and elected officials, but specifically with members of Congress, and it's easier to do that when they are at home in the district or in their state. And so because they take the entire month of August off as part of their wonderful congressional recess schedule, we chose the second week in August to represent National Health Center Week and observe National Health Center Week, knowing that it would really significantly improve opportunities to set up events with those members of Congress, and again, to have sort of in-person discussions about what's happening, what's going right at the health center, what challenges we face, and how they can be supportive. So there is a method. We don't just want to make it difficult and interrupt people's vacation weeks. There's a point to why we choose to host during that time frame. Health Center Week started out small, just as all of our work. Every time we launch a new initiative or a theme, it starts out on the smaller side. But I am happy to tell you that every year National Health Center Week grows and grows. Typically, the last probably 3 years, we've seen somewhere between 400 and 500 or 550 health center grantees that participate in Health Center Week in some way and host some type of event in every state in the country. And we are hovering around 1,200 to 1,300 events year to year for National Health Center Week, which is great. So every year it tends to grow. The other thing that I can tell you is that the size and scope of National Health Center Week events locally really runs the gamut. We have folks that do events that are much on the smaller side, just a coffee hour, before or after the health center opens as an opportunity to meet providers and learn a little bit more about the programming, all the way up to ribbon cuttings and groundbreakings, and we'll get into a little bit more about the event ideas later. But the point is, there are lots of different ways to recognize and celebrate National Health Center Week. If it's your first time looking at participating, I would encourage everybody to just be creative and don't be shy. It doesn't have to be a huge production, particularly the first year out. The only other piece is that we do try really hard year to year to create a National Health Center Week theme that folks can use to help construct their events, that can be used as more or less a hook, whether that be they want to hinge the format of the event on the theme, or they want to use the theme in order to leverage visibility in the community or to work with media outlets. We do try to look at developing a theme that represents what's happening with the program from a national perspective. And so this year, Celebrating America's Health Centers, Local Engines for Healthier Communities, we hope that this is a theme that can be tailored to some degree to fit the needs of each individual health center and their event. But I think when we created the theme, it was with the intent to showcase the fact that health centers are much bigger than just primary care providers, that we are economic engines in our communities. We employ many, many people. We are doing a lot of business in our communities, and so it's more than just providing primary health care, as you guys know better than anybody. And the healthier communities piece is that, the quality outcomes that we have and being able to make sure that our patients are well cared for is in the bigger interest of the entire community at large. When people are healthy and can access the services they need, and those services are tailored to the true needs of the community, it enables a much healthier community overall. So, the theme can be not altered, but as I said, it can be tailored to fit the format of your event. You can make it your own, but we do, again, try to create something that is useful and helpful in terms of supporting your events and giving you a hook going forward. And the only other piece on this before I move on, and I don't want to take up too much time here, but as Health Center Week has grown, even though it does fall technically in the dates, this year the 10th to the 16th, it's always the second week in August. As it's grown, it really has become Health Center Month in that certainly if somebody is hosting an event the week before, or you have an anniversary at the health center that happens to fall, a week or so after National Health Center Week technically falls, we would still consider that a National Health Center Week celebration. And so don't be shy or scared off by that that technical time frame. Of course, we see the most events occur during that actual week, and as it relates to Healthcare for the Homeless Day, certainly we've designated a particular day just for recognizing the work that goes on with this population. But if you have other opportunities to celebrate the good work going on at the Health Center and it happens to fall outside the technical framework of Health Center Week, be in touch with us and let's look at how we can still make that part of the celebration at large. So just going to go through quickly here some of the resources and just the nuts and bolts of Health Center Week. I start with this first slide, posting your events. The very best way to get visibility and potentially to leverage sponsorship opportunities with or through NAC and some of our national sponsors is by posting your Health Center Week events on the Health Center Week website. It's Health Center Week, www.healthcenterweek.com. It's a very easy process. The password to post events is healthy. You can edit and alter your events at any time, but the more that we know about your events as they're being planned, the easier it is for us to connect you with whatever resources may be available in the field. So in terms of what I would say the 5 steps to success in terms of executing a successful Health Center Week event, absolutely the best thing that you can do is start planning early. I would say even earlier than now, but I think we still have plenty of time. But if you haven't yet started really mapping out what your event might look like, now is the time to do that. I think the next piece is also to draw in the support of others at the health center, either from your board or partners in the community. I think when there is a team in place, it's much easier to plan and execute a very successful event. So make sure that you are leveraging your supporters and your stakeholders. Outreach in the community, of course, you guys are better at this than anybody. The importance of reaching out to and extending invitations to all of your elected officials, seeking sponsors, reaching out to community partners, and again, it really depends on the format of your event, but if you are planning to be involving any of these different types of partners and stakeholders, now is the time to begin that outreach. The sooner the better. And then I think you'll see there, don't forget the media. I think a lot of times the health centers that I speak with are often a little nervous to be in touch with the media because they may not have somebody on staff specifically designated to deal with communications or media. That being said, we are here to support you at NAC. I'm sure the council is as well. But they can be a really helpful partner in hosting a successful event and getting you guys the visibility that you deserve, quite honestly, for the incredible work that you're doing on the ground. But that has to start with direct outreach to them. Persistence is a big one. I think this goes without saying, certainly in the advocacy world, it sometimes can feel like we're being a pain, but in fact, so much of what makes successful events happen during National Health Center Week is being persistent and following up. Certainly that's the case with elected officials and trying to get confirmations from them that they will be there in person to celebrate with you. But it's also the case oftentimes with sponsors or community partners and that kind of thing. So I think don't quit easily. Don't give up. If you're not getting a response, then keep at it. And then the final piece is just don't ever forget to say thank you and reflect back on what went really well and share with participants or, in fact, folks that chose not to participate in your events. Let them know how the event went. Say thank you to those that were supportive to you, and for folks that, chose to stay out of the loop this year, let them know how great everything went, and hopefully when you return to them in the coming year, they'll be more interested in being involved. So event ideas, big and small, I've already mentioned that it really isn't about the size of the event in terms of what makes a Health Center Week event successful. I always like to share an example of a health center in a very small town that hadn't really done much on Health Center Week in years past. In the first year, really all they did was they purchased a Health Center Week banner, and they were able to work with the city council or the town council and had it hung on their main street. but it was wonderful advertising for them. You know, there were many people in the community that didn't really know much about the health center, and just seeing that banner and knowing that this was a week to celebrate the work and the role that they played in the community did wonders for them in terms of bringing the health center visibility and casting light on the vital role they played in the community. It was very inexpensive and very easy, but it is a very important way of celebrating. I think specifically, and I don't want to get into it too much because I think there are others that are going to speak to this, but for Healthcare for the Homeless Day, I think, you know, there are some really unique events that we've seen go very, very well in the past. I know of a couple of grantees that years back started hosting community barbecues, and as part of that, they were able to put together sort of like personal support kits, you know, hygiene kits that they handed out. And they were able to do this by leveraging local sponsors for the entire thing. And so everything from food and beverage to the kits, they were able to get pretty much everything donated. There was wonderful visibility with the media, and it was just, you know, the whole community got behind it, and now they do it every year, and it's grown and grown. So there are some really specific event formats that I think we can encourage you guys and support you guys in considering as you're thinking through what you might do for Healthcare for the Homeless Day this year. I've mentioned don't be shy about working with the media. The media can be a really important megaphone for you in terms of the work that you're doing in the community, the support and the resources that you need, and how others in the community can be supporting you. If you need any help in terms of how to work with the media, we do have a media templates available on the Health Center Week website, but we're always available also to work with you, either, you know, pick up the phone, give us a call. We're happy to help you however we can. Other tools and resources. For those of you who may be interested in looking at how you might leverage local sponsorships, we do have some more information about the steps to do that. Lots of event ideas. We have templates not just for the media toolkit, but also for resolutions, proclamations, and many other pieces. And then the National Health Center Week store for those of you that want to have just small giveaways, or if you want to engage your staff and give them something that relates to Health Center Week, there are some really cool but very affordable items on the Health Center Week store to take a look at. So a couple of other things. We do have some great social media tools. These are free. Media, when it's free, is always the best. And tools and resources, sometimes when it's free, can be very helpful. It's just a great way for those of you that are using social media to get the word out about the work that you're doing in the community, but also to promote some of the work that you're doing. Health Center Week is a great way to do that, and so we do have some social media tools available to support you in that way as well. Just really quickly, we are going to be running our picture contest and video contest this year as part of National Health Center Week 2014. The video contest is something that we started just a couple of years ago, the picture contest as well. And it's something that it gives everyone an opportunity to capture you know, the visuals of what's happening on the ground when you're celebrating National Health Center Week and translate that. So I would encourage you guys to look at what you might want to do in terms of participating in the contest this year. The picture images are pretty simple and straightforward. In terms of the video, the big requirement is that the video be under 2 minutes, but it's really meant to be something that you can capture with a smartphone. So it does not need to be complicated, but what we're looking for is just a great example of, you know, why the work that you're doing is so important, the ways in which you are participating in health center advocacy, and you know, the celebrations that you're hosting during National Health Center Week. So I will turn it back over to Brian, I believe, or are we going to our other speakers?
That's right. I'm taking it back up, and this is Brian. I'm going to give us a little bit more background on Healthcare for the Homeless Day. Thank you, Amanda, so much. Really wonderful opportunities to engage and for everyone to kind of plug in and talk about your Health Center Week events, your Healthcare for the Homeless Day events. So Healthcare for the Homeless Day is definitely an opportunity to celebrate, all the work that Healthcare for the Homeless clinics are doing throughout the year. It's a way to involve consumers in the planning and in the carrying out of the event. It's also an opportunity to raise awareness. We're going to talk a little bit about each of these opportunities, especially picking up raising awareness and advocacy at the end of the presentation. Let's look first of all at health center numbers and how these interact with HCH grantees. Health centers served more than 21 million people nationally in 2012. These are numbers from the UDS website. 72% of the clients of that 21 million earned less than 100% of the poverty level. Now, when we look more closely, we see that in 2012, health center patients, 1 million of them were actually homeless. And of those 1 million, 75% were healthcare for the homeless patients, 61% of whom were uninsured. Now, this information is important for health centers to really make the case for why HCH care is so important. The work that HCHs do is very much a safety net kind of service and just critical to the people that HCHs serve. Most HCH clients, or at least many, were able to access enabling services. These include case management, referrals, translation, interpretation, transportation, and other services. HCH clients also, many of them were also able to access addiction recovery programs and behavioral health services. These are all critical components of HCH care. Just a few more numbers. Over 1 million visits to HCH physicians in 2012. Of those 1 million, 900,000 were visits to nurse practitioners, physician's assistants, and certified nurse midwives. Overall, the total medical visits were in the range of 2,395,000, and including enabling services, medical, billing, all services and jobs within HCH, there were over 4 million visits, 4 million services provided in 2012. So as you can see, and as Amanda mentioned, the health center program is very much a job creator and very much a vital service to the people it serves. Just want to mention that HCH care is unique, not only in the population that it serves, but in its approach to the services that it provides. This is because it is done through a trauma-informed, patient-centered, and recovery-oriented lens. As mentioned, over 60% of HCH patients were uninsured in 2012. This is another piece. Now that Medicaid expansion has taken place in 26 states and Washington, D.C., more previously uninsured individuals are enrolling in Medicaid, and HCH care is playing a part in that enrollment process. So let's talk just a little bit about consumer involvement and HCH Day. An important requirement for all federally qualified health centers is that they are required to incorporate the consumer voice in their governance structures. Through board membership, consumer advisory boards, and other mechanisms, HCH consumers play an important role in helping direct health center priorities and functions. Consumer involvement and leadership is something that we take very seriously at the National Healthcare for the Homeless Council. So we really see HCH Day as a time for health center boards of directors and consumer advisory boards to demonstrate the important work that HCH patients are doing on behalf of health centers. So on this note, we're now going to hear from Camillus Health Concern in Miami, a leader from their consumer advisory board, they've already been introduced. I give you Tom Campbell and David Peary.
Thank you so much, Brian, and thank you to everyone for taking time out of your day to listen to this webinar. My name is Tom Campbell. I'm the Assistant Director here at Camilas Health Concern in Miami, Florida. We were founded in 1984 as the healthcare service of sister agency Camilas House. I've got to advance my slide here too. There we go. Camilas House was founded in 1960 as a basic soup kitchen, and now it includes a robust service delivery system with 16 locations throughout Miami-Dade County and reaching more than 10,000 individuals each year. Camilas House has over 1,000 beds of housing, including emergency, transitional, and permanent housing, substance abuse treatment, mental health treatment, job training, and general emergency services like meals, showers, mail services, and clothing exchange. Camilas Health Concern operates as the healthcare service organization for Camilas House. We operate in a 3-story headquarters building right near downtown Miami, and we have a 4-exam room satellite site in Camilas House's main campus. We are, of course, a federally qualified health center, and we're unique that we're a 330H only grantee. We only receive healthcare for the homeless funding, and our target population is persons experiencing homelessness. As Brian mentioned, because we're an HCH grantee, we have a unique service delivery model, and our health fare is a little bit different than other health fares too. We're a rather small health center considering the size of metropolitan Miami-Dade County. Last year we saw about 5,000 patients, and we have a staff of about 55 people. Our target population is predominantly male and predominantly adults. We only had about 200 pediatrics patients last year. Our relationship with our sister agency provides us with a strong referral system for housing and social services. So our patients are their clients, and their clients are our patients. We also benefit from being funded through the Miami-Dade County Homeless Trust. We actively work with the county's 30 other homeless service providers. So we have a very rich network of agencies that we work with, both for the health fair and for just getting patients in here on a regular basis. So this year marks our 7th annual health fair in honor of Healthcare for the Homeless Day. We're a relatively young event, but we're learning and growing each year. We started 7 years ago with just 1 medical provider and a handful of partners at Camilas House's soup kitchen. Last year we had 4 of our own medical providers, close to a dozen partners, and we saw nearly 300 people at the event. We've traditionally held our health fair at Camilas House's emergency shelter. This year will be our 3rd year holding it at their new 165,000 square foot campus. Now the campus is a great place for us to hold our health fair because it has 340 beds of housing, and about 250 to 300 people receive day services there every day. So just the location of the health fair at Camilas House's campus allows us to bring the services directly to the patients rather than have them try to come somewhere else and find them. It's a lot easier for them to get there. So our health fair has 4 overarching goals. The first, obviously, is to bring new patients into our health center. And as we all know, a health fair is a great way to give potential new patients a sample of what they'll get in the health center, and it helps get new faces in the door. It's a great way also to re-engage and keep engaged our current patients, and this is especially important for Healthcare for the Homeless programs because healthcare isn't always our patients' first priority. The second goal is that we want our patients to be healthy, and the health fair is a great non-clinical environment where we can showcase self-care practices in a fun and engaging way. It's a kind of a different environment where we can promote wellness and ultimately improve the quality of life of our patients. Third, we always want to raise awareness in Miami-Dade County about the health needs and the health status of persons experiencing homelessness. This goes for both our patients and for our partners. Ultimately, we want everyone to have a better understanding of how they can improve their own health. And finally, the health fair is a great way, as Brian mentioned, for us to engage our Consumer Advisory Board. They can help, on our side, they help from planning the event to executing the event and providing services right at the event. And on that note, I will pass it over to David Peary, who's the chair of our Consumer Advisory Board.
Hi, this is David Peary, and as Tom said, I'm the chair of the Consumer Advisory Board for Camilas Health. The slide that just clicked were 2 photographs of our health fair from last year in our new flagship facility. Right now, I'd like to talk about the NCAB goals for the event, and I can tell you that we look at our health fair as the flagship event for the year. This is a big deal for our CAB, and we have basically 4 CAB goals for the event. This is, overall, our goal is an opportunity for us to build our CAB, number 1, and also, more generally, to promote our organization, to promote Camillus Health, and to educate and inform individuals of the services available. So our CAB goals, first, outreach to targeted population. And how do we do this? We do this through distributing promotional flyers and our CAB flyers to spread the word and publicize the health fair. And we just basically go out into the community, bridges. We go out to where the homeless reside, park benches, storefronts, and the like. And as anybody who works with a homeless population understands that this is often a very hard to reach population and one that tends to change. There is a hard core of chronically homeless, but there's also a shifting population of folks that come in and out. And I'm always surprised at how many new people that we always encounter and people who have never heard of our health services. And as Tom previously said, we are the primary provider of healthcare services to the homeless population within this area and the only healthcare for the homeless grantee within Miami-Dade County. So we provide very important and vital services. So the second thing that we do in terms of outreach is as we inform our targeted population of our services, we really want to get them to use our clinic as their primary care providers and divert them away from the use of the local public hospital emergency rooms. We have a local hospital, a local public hospital not too far from where we are, and we are constantly trying to emphasize the need for primary care services and not wait until your health conditions worsen to the point that you're not eligible for emergency care, for obvious reasons. Our second goal is, and that segues into the second goal, is to recruit new CAB members. It's very important for us to constantly build, maintain, and diversify our CAB membership. As a healthcare for the homeless grantee, as Brian had pointed out a little bit earlier, consumers have a statutory and a vital role on the board of the CAB. Their voice, on the board of the directors for the health clinic. And it's very important for us to diversify our CAB membership so that we get voices from all segments of the homeless population, black, white, Hispanic, Haitian, Creole that you'll find down here, gay, straight. We want everybody to be able to have a voice and to be able to articulate their individual and unique interests. And so, as I said, it's extremely important for us to constantly make sure that we are adequately representing the homeless population. And secondly, when it comes to recruiting new CAB members, we would like to find those people who are activists. There are a certain number of people within the homeless population who are interested in terms of helping to impact positively other people's lives. So our third goal is we basically work with clinic management to ensure the success of the health fair. And how do we do this? One big way that we do this is we help stuff the goodie bags of corporate donations. Last year, we got about 300 bags of thermoses, cups, T-shirts, etc. And this is really a big part of the health fair. Everybody gets a prize. Everybody gets something to walk away with. We also hold a lottery where just about everybody won something during the lottery, and it's very important for everyone to walk away with something in hand. I think we also maybe even had knapsacks and the like. So our stuffing these goodie bags takes up pretty much the whole part of the day. We spread everything out on a huge table in the conference room, and we've got, as I said, about 300 bags. And basically by the time we're all finished, these bags are pretty much stuffed to the hilt. On the day of the event, we wear our CAB T-shirts. Basically, we're showing the flag here. Okay, we greet everybody at their front door, and we generally circulate around the facility in order to facilitate the services of the event. And we also want to answer questions and basically just collaborate with management to, as I said, to ensure that the event is successful. And finally, it's also important for us to invite local elected leaders to the event in order to show the importance of our clinic in furnishing healthcare services to the indigent and to the homeless. Once again, we are the sole provider of healthcare services to the homeless and indigent population in downtown Miami. So it's very important for us to show to the elected leaders and to educate them on our very important, vital, and unique role in providing these healthcare services. On that note, also I'll show you two more pictures. In the upper right-hand corner, you'll see one of our service providers. I'm not sure which one this is, but these are two service providers that we invited to our health fair, and they're engaging with one of our clients. And in the lower left-hand corner, you'll also see the same thing. One of the service providers, I believe this may have been one of the anti-smoking or smoking cessation provider, was engaging one of our clients there at our event. And on that note, I'll hand it back over to Tom.
Thanks, David. I'm going to build off the slide that Amanda presented with some tips to make your event successful. Just like Amanda said, you want to start planning your event early. I know we just had our first meeting last week. You want to try to do it probably at least 2 to 3 months ahead of time, maybe a little bit farther out if you're planning a bigger event. For us, planning our venue is relatively easy because it's at our sister agency's location. But if you're planning something off-site, like at a civic center or in a park or a public place, you might need a few more months to get that place, that spot secured. As you're doing your planning meetings, you want to include your various stakeholders and contributors. For us, we include our chief medical officer, our clinical director, and our care coordinators to make sure that we have everything we need from the clinical side, and then we include our facilities manager to make sure our logistics are set. We also include members from Camilas House because they're our hosts, and of course we invite our consumer advisory board. Now if you have other strong partners, you want to include them too. Just bring everybody to the table, let them have some buy-in, and then it will make the event a lot more successful. And one last thing with planning, it's probably best to assign the event to a single point person. You'll have that one person who knows the event inside and out, forward and backwards from the very beginning, and it helps avoid chaos in the actual day of the event. So you can't have a good health fair without having some patients in attendance. So when you're reaching out to your patients, be sure to pick the avenues that your patients will receive the message through. For us, Facebook, Twitter, social media is great for donor relations, but not necessarily our homeless patients. For us, we work it through our partnering homeless service organizations and through the Miami-Dade County Homeless Trust. We create a flyer, we send it out through all the email distribution lists, and then we have our transportation guide take the flyers hard copy to all the emergency shelters. When you're developing your message, be sure to keep your target population in mind, and this is something that you do anyway in your regular operations. Just make sure you tie it over to your health fair. In Miami, we're very culturally diverse, so we print everything in English, Spanish, and Haitian Creole. And make sure your message is inclusive. We also announce on our flyer that we have interpretive services available for the hearing impaired, and we actually provide those on the day of the event. I talked before about working your network to actually advertise the event, and you want to work your network to bring in relevant partnering organizations to provide direct services for patients. Now, these are agencies that you're very likely already working with, and for us, we have a lot of referral sources. The health fair is a good way to co-locate those services so people can get a one-stop shop kind of deal. This year, we're planning to expand and have legal services. In the past, we've had a really successful one with SafeLink that provides free cell phones and minutes. That's a very popular one with our population. And of course, if you can partner with somebody that can provide food, that's always a great way to get people in the door. They like to get fed. For us, that partner is Camilas House. They have a very outstanding meal service program. And like David said, everybody likes to get stuff. So make sure that every person that attends the health fair gets a goodie bag when they're walking out the door. You can work your partners, your suppliers to give you stuff. We've had a couple agencies that have given us a grant, so we get to go shopping, and that's always a fun way to get stuff for the goodie bags. And remember, every health fair is different. These are just some of the things that we do for our particular Healthcare for the Homeless project. There's different things that other agencies can do, and I hope that this has provided some little helpful information for you. And with that, I'm going to pass it on to Amanda.
Great, thanks guys. It's really exciting for me to be able to hear. I am fortunate that I get to hear about all kinds of great events that go on around the country, but you guys just, I wish I could take you with me on the road and have you speak to a lot of our colleagues about the good work that you guys have been doing and how to produce a really successful event. So keep me posted on how this year is coming along. I'd love to find a way to be supportive. So the other piece that we wanted to just talk about is the advocacy component, the direct advocacy component of National Health Center Week, and sort of the relevant advocacy work that we are doing right now and how it ties to this year's celebration. So I'm hoping that those of you on the webinar today have heard about and are already participating in our Access is the Answer advocacy campaign geared at fixing the health center funding cliff. Just as a refresher, this is the advocacy campaign that we launched in order to force Congress and the President to act swiftly, we hope, to make sure that the health center funding cliff, which is currently set to take effect for fiscal year 16, as soon as possible. And just as a reminder, that health center funding cliff will equate to a 70 to 60% reduction in health center funding when it takes effect in FY16. If you have any questions on the breakout on that, please feel free to be in touch with me after the webinar offline. I'd be happy to sort of walk through the details with you. But again, the goal of the campaign is to demonstrate just a massive, massive outpouring of support at the local level for health centers in our communities. And we are right now in the first phase of the Access is the Answer campaign, which involves 3 specific action steps. So again, I'm hoping that those of you guys that are participating today may have already been active on these things, but we started out the Access is the Answer campaign asking folks to take action on an Access is the Answer petition. Again, this was addressed to Congress and the President. We asked folks to put it in their waiting room, take it with them to community events, work with community partners to be collecting as many signatures as possible, again, to show that there's just a high level of support and urgency to Congress and the President taking action to make sure that the funding cliff is addressed. The second action step is the collection of local support letters. We did set specific goals associated with each of these action steps. It was 500 signatures we asked every health center to collect on the petition. And for the letters, we asked that every health center collect 5 letters of support from local elected officials and 10 letters of support from community partners and supporters, which really can range from the local hospital to the chambers of commerce to the local United Way. It really kind of, there's a variety of ways to describe or define community partners and supporters. But the purpose was to make sure that we were collecting these letters of support to show that it's not just the health center that expects Congress and the President to take action to address the funding cliff, that others in the community recognize the vital role that the health center plays in the community and are willing to publicly step up and say that this needs to be addressed. So the point in collecting all of these materials was to then be able to present them in person to various members of Congress at events locally in the district or across the state. And so, of course, Health Center Week, as we've already discussed, is really a perfect opportunity to do that. And so I would just encourage you guys, as you are planning your events, certainly to be inviting your members of Congress. We've already covered that. But also, as you have been active, or if you haven't been active on the Access is the Answer campaign, look at how you can begin taking action to collect the petition signatures, begin collecting the local support letters, so that when you have these elected officials there for your events, you are able to present them in person. So I will just point out, we do have resources to support you guys in the Access is the Answer campaign on the Campaign for America's Health Centers website, which is www.saveourchcs.org. There's an entire tab dedicated to Access is the Answer where you will find petition templates in English and Spanish, the same thing for the local support letters for elected officials and community partners. Those are also translated. We do have report forms. We really want to hear from you guys when you are successful in launching your petition efforts and or collecting these letters. We want to recognize the work that you're doing on the ground. And then there's also some tools on there to help you spread the word. But again, as with everything that we do with advocacy, we are constantly looking at all of the different tools in the toolbox and how we can make sure we're supporting both sides of every equation. And so all the work that we're doing on the Campaign for America's Health Centers and the Access is the Answer campaign should translate to the work that you're doing on the ground for National Health Center Week. And so again, just take advantage of those events. And even if you don't have an elected official or a member of Congress that's planning to be present, make sure you use it as an opportunity to educate your community partners, certainly to talk with the media about what we are facing with the health center funding cliff and what it would look like if you sustained a 60 to 70% cut to your funding. So I will stop there and hand it back over to Brian.
Thank you, Amanda, and thank you, David and Tom. So far, I think we've heard some great stuff. I'm so excited by the opportunity that health centers have to get people involved in advocacy for health centers. Very important piece. I'm also just going to mention the outreach opportunities that have pretty well been covered, but HCH Day does provide an opportunity for HCH providers to do outreach around Medicaid enrollment. Navigators, outreach workers, enrollment specialists can definitely take advantage of the opportunity to meet with people who maybe are not already enrolled. This is in states that have expanded Medicaid as well as in states that have not expanded Medicaid. There are some provisions that make the application process easier regardless of which state you're in and the status of your Medicaid expansion. HCH Day, as David and Tom mentioned, is also just a great opportunity to promote other health center services, whether that's through screenings or different things that would invite people in, let them know that it's a welcoming place, just display the different services that are available. And it's also an opportunity if you're collaborating with others in your community that are service providers for them to do outreach and engage with people that they may not be able to access otherwise. And we also see HCH Day as a good opportunity for voter registration. It is in August, so it's probably a good time. Maybe, I don't think there's ever a bad time for people to register to vote, but HCH Day is certainly a good time for that. HCH Day is also a good day for advocacy. We have talked about this in terms of health center funding. We also need to talk about it in terms of Medicaid expansion. As most folks probably know, Medicaid expansion would cover people who are under 100% of the poverty level, and this is happening in 26 states in the District of Columbia. It's a wonderful thing in those states. We also want to make it, an issue in those states that are not expanding, and we do see the healthcare for the homeless community as a great place to do some of this work. During the National Healthcare for the Homeless Council's national conference last month, we set up a Got Medicaid booth, and I'll show you some pictures in just a minute. This was an opportunity for people from different states to have their picture taken and hold up a sign that describes why they want to see Medicaid expanded or why they're grateful that their state has expanded Medicaid. I'll show you those here. So it has a nice face. People are smiling. They're happy to be participating, but the message is very powerful. Medicaid can save lives, can help end homelessness. We know this is true, and having a Medicaid expansion, Got Medicaid photo booth could be a good thing to do at your HCH Day. Petitions and stories, people kind of giving a fuller narrative description of how Medicaid has helped them or could help them is also a nice activity. Just to refer back to Amanda's campaign, NAC's campaign to support health center funding. It is also something that we very much support at the National Council. Also, different communities are going to have local and state issues. HCH Day is a good opportunity to have a table and highlight some of those things, whether that's directly related to HCH or could be related to housing, could be related to jobs. It's definitely an opportunity to bring those issues together. And we know that it's a good time to do that and encourage you to partake in that. So now I just want to kind of wrap things up. I think we've had a nice discussion here, and I wanted just to kind of bring it back to the fact that HCH Day, we see this as an opportunity to celebrate the services that are being provided, the life-saving, wonderful services that HCHs and health centers are providing. It's also an opportunity to raise awareness in your community that these services are available, both to bring people in for services as well as to let people know who just may not otherwise know and who could become advocates or could become donors if that's something that your health center takes, and then also the opportunity for advocacy. And I'm going to open it up for questions and answers now. And I do want to go back. I mentioned that Medicaid expansion was available for those 100% and under the federal poverty level. It's actually available for those 138% under the federal poverty level. So, you know, it's a great thing for many people who are struggling with low incomes. So we are open for questions. I do encourage our webinar participants to go ahead and type in questions in the chat box at the bottom of your screen. We do have a couple questions, one for David and Tom, and then one for Amanda as well. I wanted to start by asking you guys, David and Tom, if you have some advocacy, an advocacy piece to your HCH Day and what that's going to be like. I know you mentioned the inviting elected officials to come. I want to see if there are particular things that you are hoping to a message that you want to send to them, and if you could tell us about that.
Sure. This is David Perry. We do not have a formal, at this point, advocacy campaign. We do have a goal of inviting elected officials to our facility to have them look around. As most of you know, Florida is a non-expansion state. And so, you know, we do have a major issue here with convincing people of the good aspects of Medicaid expansion and how it will help us to improve and expand the services that we provide to our targeted population. So one of the plans that we do have are to get the local leaders and state legislators, state representatives, and state members of the state Senate, and just to put them on the front lines and show them that there's maybe perhaps a difference between the ideology and being in the ivory tower of policy versus being on the front lines and seeing the human faces of the people that we actually serve. And I think that's very important. So yes, in a short word, you know, we're hoping to have some elected leaders at our health fair.
That's great. That's great. And certainly the experience of inviting elected officials and developing a relationship with elected officials, we definitely see that as a positive and a way to have access to decision makers, and certainly can help in future efforts to seek policy change or to do some advocacy. So thank you for that. Now I want to ask Amanda, regarding the health center funding cliff, could you tell us how that impacts the different types of health centers, and will it have the same sort of impact on health care for the homeless health centers as others, and how will that play out unless something's done?
Sure. Yeah, no, it's a good question. I think, to be honest, I think there's some misperceptions or confusion around how the funding cliff will affect different types of grantees and newer grantees versus longstanding grantees. The reality is that every health center grantee will sustain the same type of cut as anyone else. It doesn't matter if you are a homeless grantee or if you're serving the farm worker population, you're a migrant health center, everyone will sustain the same cut. And the reason for that is that basically, you know, without getting too into the weeds on this, the health center program receives funding from two different streams. One on the discretionary side, which is our annual appropriation. So right now we're working at trying to make sure that our fiscal year 15 appropriations stay intact the way that they were intended to, in accordance with the last year of the Affordable Care Act Health Center Trust Fund. The other stream is on the mandatory side, and that is directly linked to the Affordable Care Act. And what Congress did when they passed that law is that they carved out $11 billion just for health centers, as everybody will recall. And there was a plan for how that money would be allocated and used year to year in order to build the capacity of the program to care for additional folks coming into coverage. Obviously, the intent of the Affordable Care Act is that everyone would receive coverage. That's changed a bit, but what's happened over the years is that we have sustained cuts on the discretionary side. So as Congress has looked to reduce deficits and through sequestration and some other things, they have reduced our annual funding on the discretionary side. And we are fortunate in some respects that they were able to backfill those cuts using some of the dollars contained in the trust fund on the mandatory side under the Affordable Care Act. But the reality is that after fiscal year 16, or actually really at the end of fiscal year 15, the trust fund is done. There's nothing after that year. And so we're in a position now where, without covering for those lost dollars and in trying to make up the difference in the cuts that have been sustained on the discretionary side, it will equate to a 60 to 70% reduction in funding for all health centers.
Wow. Wow.
Yeah, it's very serious.
Wow. So we definitely see this as a front burner issue, and this is obviously a time coming right up to elections in the fall. We do encourage people just to have these things in mind as we're moving into that. I want to see if there's anything else that you'd like to add, Amanda, Tom, or David. Anything we didn't cover or that you'd like to elucidate on just a little bit more for us?
I guess I would just say that you guys have an incredibly important story to tell on the ground, and Health Center Week is a really, really important time to be doing that. I think that to David's point, I believe, was the one who made the point that, it is also should be a goal for everyone to invite all of your elected officials at every level and make sure that they are educated about the work that you guys are doing, how vital you are to the community, and just telling the health center story, because as much as those of us at NAC and the council and our state associations, we work really hard at representing the health center program and the patients we serve, but there is nothing like hearing it from the people who are on the ground doing the work and treating our patients and from patients themselves. So please, if there's one thing that you walk away with, I hope that it's that you'll tell that story during National Health Center Week.
Awesome. And Amanda, just one, and I'm sorry, Tom and David, did you guys have something else?
Well, this is David Perry. Just one thing I wanted to say that, aside from the very serious and timely issues of providing services and advocacy, is that, one overarching thing is that this is just a fun day. It's a day for celebration, and that ties in very well with the theme of celebrating our health centers. And I can tell you from last year, everyone left a smile on their face, and it translates into some very good, strong goodwill throughout the community. So, aside from the very serious issues here, that overall, it's a way for everyone to have a lot of fun.
Absolutely. Okay, we have one more minute, but I did want Amanda to go back to a question related to the impact of elections that could have on inviting a member of Congress to an HCH Day or a Health Center Week event, considering that there may be candidates in a jurisdiction that the health center is within.
Yeah,
with the,
so yes, no, it's a good question and it's a good thing to clarify really quickly as we wrap up here. So it is an election year, and so everybody just needs to be very conscious as they are inviting their officials. If it is a sitting official, then you are free to invite them, but you need to be very clear that it is not in any way to be interpreted as an opportunity to campaign. It is not meant to be used as a platform for them to speak to their agenda. I think that it is always good practice, and folks should be inviting candidates at the same time. If you are going to invite a candidate, you have to invite all candidates, meaning that they don't all have to come, but you have to extend the invitation to everyone in order to ensure that there's no misperception of partisanship. And so it's good practice to do that anyway. And I would just say also, where it is an election year, now is the time to start getting to know those candidates. So if you haven't done so already, ask them to come and tour the health center. You know, give yourself an opportunity to get to know them a little bit, to educate them about the health center, but you know, to make sure that it's on their radar. You never know who's going to be successful, and even those who are not successful, if they are ambitious enough to run for office, they probably have bigger things in mind, even if they don't win the seat. So, but if you have any questions on that, we're happy to help too, just on the legalities of advocacy in an election year.
great, great. Okay, well that wraps it up, and I think this has been a really great conversation. I encourage folks who have questions about Health Center Week to please visit the website here at the top of the screen. If you have events that you're planning or events that you have already done, please post them on the Health Center website. You see the password is healthy. Any questions about Health Center Week, please reach out to Amanda Parrish-Kelly. There's her email address and phone number. If you have questions about HCH Day, you can contact me. My email and phone number there. And then we definitely encourage you to check out the National Healthcare for the Homeless Council's website. Check out our policy materials, especially. I think those are relevant. Okay, thank you, everyone. And please have a great HCH Day and National Health Center Week.
Thanks, Brian.
Thank you.